Good evening, everybody. I'm Nancy Gershman, and I'm the event co-chair, and I'm very excited to welcome you to Living with Intention. While we're still facing the challenges of COVID-19, this is a fun and safe way for us to gather together and learn how to look better and feel better naturally. We have over 100 women on this Zoom call tonight, and we are thrilled and honored to have each and every one of you here. This is the first time we've gathered women from across our community in 2021. We feel now would be a great time to recite the Shechianu. Could everybody please join me? Baruch atah Adonai Eloheinu melech haolam Shechianu v'kiyamanu v'higianu lazman hazeh. Thank you. That was really nice. Now let's take a look at some of the ways our Jewish Federation has made an impact over this past year. Sam, please roll the video.
Without the support of Federation, we wouldn't have really been able to do everything that we've done.
Every dollar that Federation gives is a dollar invested not only in the future of the Jewish community, but in the worldwide community.
The Federation is much more about reaching out to us in creative ways to listen together, to think together, to work together in creating common solutions.
There's no organization raising funds in the way that Federation does, at the magnitude that Federation does, to support communal needs. The key factor holding Jews together to their Judaism and to each other has been education.
A New England Jewish Academy graduate leaves our school having received a robust general studies education and a very full and dynamic Torah education. What we believe is not only that we have these two elements in our lives, but we believe that they're actually woven together.
If I'm teaching a text, it's not just about what the text says and what are the underlying values of the text, and then how can you take that and apply it to your life.
Producing a student who has all the capabilities and the knowledge and the skills to go on to whatever they do, but with a firm sense of their Jewish history and their Jewish understanding.
They don't only teach you the educational purpose, but they teach you life skills. They teach you how to be a good person, how to be a good Jew. They get me ready for what I have to do in the rest of my life.
They're ready for a gap year in Israel or the college campus of their choice.
Hillel has inspired me after I leave college to seek out similar communities to both lead and be a part of.
It's really nice to have that community where you can connect with each other on a personal level through your Jewish heritage, through your Jewish backgrounds.
When COVID-19 hit, we were able in a matter of weeks to raise ultimately almost $1 million to support core social service needs, as well as institutional needs and PPE needs.
Our local federation has been tremendous. This has come through in multiple ways, but really significantly this year as we're facing COVID, school closures, and as we were doing tremendous amount of work over the summer to reopen safely. They're all the things that you have to do, and we would not have been able to do that without the Rapid Relief Fund.
We are more committed than ever to expanding and deepening our relationships, our intergroup and interfaith relationships, as a means to address social justice issues, to foster collaboration.
There's a broader sense of pain throughout the community as well, around racial issues, around recognition of people of different sexual orientations. The work of a lifetime in many ways, but also the work of necessary action that speaks again from our values and our need to be activists in making a difference in people's lives.
The JCC is a Jewish place for all people. We welcome the entire community to the center. In many ways, we're a bridge into all aspects of the community. The funds that the Federation allocates to the Mandel JCC are used in a variety of ways. They support our senior adult programs, our cultural arts events. They support the programs we provide to young adults with special needs. And they provide us funds that help to support Camp Shalom.
When I first think of Camp Shalom, I think of variety because of not just all the activities, but about all the people.
I keep going back to camp because I feel like I've just made so many great memories at that camp, and I just want to keep going back to make more.
There's a famous saying in Jewish philosophy and Jewish thought, Rabbi Hillel, if I'm not for myself, who will be for me? If I'm only for myself, what am I? If not now, when?
The Federation is here for us, and it's our responsibility to be there for the Federation in order that they can support all of the wonderful initiatives. The Federation is the model for giving, and that's something that we teach our children.
Hello, everyone. It's so great to see all of you tonight. I'm Judy Schlossberg, your Women's Philanthropy Chair for what we hope will be a much better year of 2021. As we just saw in the video, our Federation and its partners are ready to respond to unexpected community challenges at a moment's notice. And even with COVID-19, we haven't missed a beat supporting all the Jewish institutions that make Greater Hartford such a special place to live. Thanks to your gifts to the 2020 annual campaign, we were able to award nearly $1.2 million to 20 local agencies, schools, and synagogues. And we're building an even stronger tomorrow through some exciting new initiative that I'd love to tell you about. We've established a Jewish free loan fund that gives interest-free loans to local individuals, families, and small businesses in need. We're working with local synagogues, day schools, and youth groups on bold new ways to get our children and young people excited again about Jewish learning through a project called Education Reboot. We're welcoming the wave of Jewish families who are leaving New York and other places for Greater Hartford through a new venture we call Destination Hartford. And we're taking concrete steps to mobilize our entire community against security threats through our new Secure Community Initiative. Wow. The 2021 annual campaign is going amazingly well. We've raised more than $3.2 million so far. And you know, 35% of that is from women's philanthropy gifts. We know the needs in our community are going to continue to grow, and you're rising to the challenge so generously. And I thank you. This is such an exciting and inspiring time to be a Federation leader. But before I turn the program back to Nancy, I would like to recognize some of our partners in this work. First of all, my partner, Lori Mandel, is a longtime Federation volunteer, and we are so excited to tell you that she's now a full-time part of our staff as Associate Vice President of Women's Philanthropy, and she's fabulous. Haley Wasser, our Vice President of Development, joined our team in September. Haley, can you wave to us? She's held leadership positions at the Houston and Atlanta Federation, and she'll be moving from Michigan to Connecticut this spring with her husband and their children, Abe and Maisie. And of course, Carolyn Gitlin, Chair of the Federation Board, and Dana Keller, our annual campaign chair and first vice chair, provide amazing leadership, not only for the campaign, but for our Federation as a whole. Thank you to Dana for helping us secure our wonderful speaker for tonight. I'm so grateful to Nancy Gershman and Jessica Fish, our wonderful event co-chairs, for making this evening so special. And of course, I want to thank the rest of the Federation staff who worked on this program. But now I'd like to turn the program back over to Nancy to introduce Dr. Stagg and Jessica, who will be moderating our conversation. Thank you again, and have a wonderful evening.
Where? Thanks, Judy. I'm delighted to introduce Jessica Fish, my co-chair for this event, and our moderator tonight, and of course, our guest speaker, Dr. Jennifer Stagg. Dr. Stagg is a practicing naturopathic physician, and she is the founder and medical director of Whole Health Wellness Center in Avon. She has authored 2 books, including the one you'll be receiving soon after this event, Unzip Your Genes. Dr. Stagg is an expert in precision medicine, an emerging approach to disease prevention that incorporates your genes, your environment, and your lifestyle. In Unzip Your Genes, she provides practical steps to radically transform your health and well-being. She'll share some of her insights with us during our conversation tonight. Please welcome Jessica Fish and Dr. Jennifer Stagg.
Thanks, Nancy.
Thanks, Nancy.
You're welcome.
Dr. Stagg, we are so excited to have you here with us tonight. These days, it is more important than ever that we take care of our health, not just for our own well-being, but also for our friends and family who rely on us in tough times. Healthy bodies and healthy communities go hand in hand. Before we get started, I just want to let everyone know that you're welcome to enter your own questions for our conversation throughout the evening in the Zoom chat. Lori Mandel will collect the questions. Go to the bottom of your screen, click on the word chat or on the chat bubble to open the box, and make sure that you select Lori's name from the dropdown. Type in your question and send it, and we will get to as many as we can. So let's get started. Let's begin with, can you tell us what is a naturopathic doctor?
Yeah, absolutely. I get this question often because a lot of people have not really heard, maybe they've heard that term, but they're not sure what we actually do. So in Connecticut, we are licensed healthcare providers. Most of us take insurance. We're recognized as specialists. We order blood tests, we order imaging, we can treat, diagnose illness. What really differentiates us and our approach to healthcare, I would say primarily is our emphasis on lifestyle medicine. And so that really is looking at the impact of your diet, exercise, stress, on various, symptoms or conditions that our patients may be presenting with. And we also take a very holistic approach. So we're looking at, mind, body, spirit, how all of that, melds together and can impact our overall health.
Wow, that's really interesting. So, okay, the name of your book was Unzip Your Genes. Let's begin with talking about genes. What is it that we need to know about genes and how they impact our health?
Yeah, so probably up until about 20 to 25 years ago, we thought that our genes, that was it. We sort of had this DNA code and there was nothing really we could do about it. And, what we inherited from our parents would be essentially our health outcomes. So if we saw our parents with diabetes or Alzheimer's, we mostly would expect that that could be our, destiny. So, this concept of our genes or our destiny was essentially what was thought. But emerging science kind of opened up that field. There were some really, landmark studies that came out and heralded the onset of a whole new era of genetics called epigenetics. And what that really means is that how we live, how we choose to live, our intention for our lives in terms of how we think, how we manage stress, what we choose to fuel our bodies with, our physical activity, all of those things impact how our genes actually get expressed. So although that doesn't change the actual DNA code itself, these genes, many of them are fluid and can be impacted by our lifestyle, which helps us really understand why we can have, a parent or 2 parents with a condition, we don't have that we can have those genes, but we don't necessarily end up with that particular illness. So it was really, really interesting. And more science has emerged. And, you know, every day there are more papers that come out on this. And essentially, you know, the emphasis and what I was looking at, the angle that I was looking at when I wrote my book was to inform people that there are some of these, what are called SNPs, SNP, it's an acronym for a long word we don't need to talk about. But essentially there are these SNPs variants that we can, if we know that we have them, there are very targeted actionable steps that we could take. So for example, if we do genetic testing and we find out that a patient has this particular SNP for diabetes, like type 2 diabetes I'm talking about here, if we put that patient on a Mediterranean diet, it can completely turn off that gene. So someone can have a gene for type 2 diabetes, they can go on a specific dietary lifestyle plan and not manifest that disease.
So there are diets that could be a better match for your specific type of genes?
Absolutely, yeah. So back in about the study, there was a really important small clinical study that came out in 2010 at Stanford University. And they looked at a series of different genes, and there were 4 different dietary types that were basically profiled. And they mixed patients and gene matched them to their diet, or matched them to another, or didn't match them, put them on another otherwise healthy diet. So they weren't being compared to like the standard American diet. And they followed these folks for a period of time. And the people who were on their genetic matching diet, so this could have been like a low-fat diet, it could have been a Mediterranean diet, but on their specific gene matching diet, those patients lost 2.5 times the weight than the other group. And there were also secondary outcomes that were observed. It was a really small study, so a lot more could have been discovered from the study, but they did also find that people on their matching diet also lowered their cholesterol from being on their gene matching diet. So we know that diet obviously impacts health outcomes.
Can you discuss how genes influence our behavior related to food intake and the types of food that we crave? Isn't there even a gene for your sweet tooth?
Yes, absolutely. So there's actually a gene for sweet tooth, and it has to do with how glucose is sensed in your brain. So it will drive people. Now, let me just say that sugar is highly addictive. So if you if you start eating sugar, you may not have the sweet tooth gene because sugar on its own is very highly addictive. It actually lights up the brain in the same area that like hard drugs light up. But there is a gene that is profiled that will result in people eating a lot more sugar, tend to crave sugar. And this has been profiled even in patients who are overweight, but also who are not overweight or in that normal weight range. There are also other genes that impact our behaviors. And so a lot of people know that they, like what they should be doing, but they're more so having trouble with what we would call compliance or like behaviors associated with eating. And it makes it much more difficult to be compliant if you have some of these genes that dictate behavior. So another one of those genes is a gene for emotional eating, or what we call eating disinhibition. So that's like the stress eating gene, and it's really common. Studies say it's somewhere between 60 and 70%. And so even in a setting where, it may not be stress, it could be, like a party, not anymore, not these days, but a party where there's food out on the table and you're kind of like keep going back and you're thinking about like what you're going to eat next. That can kind of manifest in that way. There are genes that people can have that will control like how full they feel, like actually satiety.
genes that will drive you to be sort of a snacker, where you're kind of like just constantly grazing. So, you know, sometimes when we profile these genes, because you can do a very simple salivary test to look at these genes, when I profiled those, it tends to, people who really come in and they're had a lot of trouble over their lifetime maintaining a healthy weight tend to have a lot of those behavioral SNPs, those behavioral genes.
So they're not always our fault, it sounds like.
Absolutely. And I've had women who are, you know, crying in my office because they feel that, you know, they now understand, they felt so much guilt related to food.
One of the questions from our audience, you mentioned food sensitivity. Are they, the food sensitivity tests, are they all created equal, or is there one that you might recommend more than others?
Yeah, so food sensitivity testing is, you know, a really wide open field, and there are a lot of different types of tests that you can do. They're not always accurate. So the gold standard for food sensitivity or food intolerance is really an elimination diet. So like eliminating the most common food allergens for 3 to 4 weeks and then challenging them. So over that time frame, if you know, feel better without that food and then you reintroduce that food, and you actually have symptoms like bloating or, you know, rash or, you know, digestive distress, then that shows us more of this food sensitivity or food intolerance.
Got it. Okay, so we're going to move on to inflammation and aging. We hear so much these days about inflammation. Why is addressing inflammation so important when it comes to our overall health, and how is it involved in aging?
Yeah, so inflammation is one of the, you know, underlying factors in chronic disease. So most chronic diseases like diabetes, cancer, cardiovascular disease, all have this underlying inflammatory process. So first of all, when we have inflammation, we're at risk for increased chronic disease. The other thing that we know now is that inflammation is very much involved in the aging process. So if we can slow down inflammation, we can slow down aging. We certainly can't halt aging yet, but we can slow it down by addressing inflammation. That is one of the factors involved in aging. There are many factors, but inflammation seems to be one of the major determinants of aging.
So what can we do to better manage inflammation?
Yeah, so there are a number of things that we can do. So, and these all kind of go right into naturopathic medicine, the things we talk about every day in terms of lifestyle medicine. So staying active is really important. Not overdoing it with exercise, because when you excessively exercise, that actually has an inflammatory response in the body. So too much exercise, not good. Good amount, like, you know, 3.5 hours total a week. We talk about 150 minutes seems to be, you want to get to that threshold. And you can do a little more than that, but like at least 150 minutes a week of physical activity. Diet, you know, a healthy diet, rich in plants, lean protein, that's really important for reducing inflammation. And one of the really big factors is if you have excess body fat, which usually sits in your midsection, this visceral adipose tissue, or what we call fat, that acts like its own organ of inflammation. And of course, as we get older, it's harder and harder to lose that fat, but that's one of the most important things we can do to lower inflammation.
Is lower that area. So that kind of leads us into our metabolism. We know as we age, we are all too familiar with finding it harder and harder to combat weight gain as we age, especially what you were talking about, that dreaded belly area. How does our metabolism change as we age? We know estrogen levels decline, but what about some other hormones? Is it lesser known hormones?
Yeah, so there are a number of other hormones that can result in some of these symptoms that we see related to aging. So one that you've heard of as maybe a supplement, melatonin, is a hormone that declines with age and is really important for regulating cortisol, which if you're under a lot of stress, you can have high levels of cortisol, and melatonin basically acts like, you know, the opposition to that cortisol. The other thing is melatonin on its own is an antioxidant. So it has this ability to help regulate immunity and the aging process. When at about 60, you have about 50% of the melatonin level that you had like earlier in your adulthood. Another hormone is growth hormone. Again, we don't hear a lot about growth hormone. You know, sometimes you'll hear about celebrities doing growth hormone injections. Those are really expensive. There's a lot of risk and side effects. I really don't recommend those. But there are some natural ways that we can increase growth hormone, and growth hormone is important. Again, that declines by age 60. Again, you've only got about 50% of that left. But reducing belly fat improves growth hormone levels, decreasing sugar in your diet, intermittent fasting, exercise, maintaining good sleep. All of those can help regulate growth hormone levels. And then back to melatonin, some of the ways that we can increase natural melatonin production, because melatonin is a hormone that we make in our body, although we all think about it in supplement form, and sometimes that is necessary. Although I would recommend checking with a doctor that is knowledgeable about melatonin to make sure that it's right for you, because there are some contraindications for melatonin in some conditions. But like melatonin production is some of the things that you can do to help regulate and increase melatonin production is like getting outside and getting a lot of natural daylight, like earlier in the day. Limiting light exposure at night. So like really sleeping in a really dark environment. And then limiting exposure to blue light before bed. So if you're on your phone or on a laptop or looking at TV in the dark, you really want to avoid that within 2 hours before bed. And there are even blue light blocking glasses that you can get now for that.
That's okay. I want to go back really quickly to, we were talking about inflammation, and we had a couple viewers that were saying, what exactly is inflammation?
Yeah, so inflammation is an immune response that we really need. So it is like, you know, it's a necessary process. So the inflammation process starts when you like injure yourself, or if you have an infection or you cut yourself. That's what allows us to heal. So immune cells come in and inflammation gets turned on, which is a whole cellular immune response. So there, you know, there's a purpose to inflammation. But what happens is that as we age, and in many cases because of lifestyle choices that we're making, but also just the result of aging, inflammation doesn't get turned off. And so it's smoldering. So you have what's called systemic inflammation or chronic inflammation, and that's problematic, but it's an immune process.
Okay. So an immune process, but that it's a necessary one, but
right. So we don't want to get rid of inflammation. There's a purpose to why we actually have, why we have like evolutionarily why we have inflammation. The same reason why we have like the ability to respond, like and have stress response, because, you know, we needed it, and we do need it at times, but it's when it's chronic and low grade, it creates problems.
Okay. So next I want to get, well, actually, let's go back. You had said something before about intermittent fasting. You said those words. Some of us have heard of intermittent fasting. Can you define what it involves and whether that's something that might be helpful for us?
Yeah, so intermittent fasting is essentially where you go, you know, a period of time without eating. So you're condensing the amount of time during the day where you're actually eating. So you have like this smaller eating window. And research, there's a lot of clinical research around intermittent fasting, and there are a lot of benefits to intermittent fasting that have been described. But in the data, the time frame is somewhere between 14 to 18 hours. There's a lot of studies there, but it seems like 14 hours, meaning fasting. You do want to stay hydrated during that time, but it would be like no solid food, basically. You're just drinking water. So that would look like your day, you know, you start eating at 8:30 and you stop at 4:30, for example, or you can bump that out a little bit if you're going to 14 hours. And, you know, for some people that really can make a difference for them. It can help regulate glucose a little bit better. It can help improve, it actually has some effects at lowering inflammation. It can improve our microbiome. But for some people, intermittent fasting is not advised. So certainly anyone with an history of an eating disorder, people on diabetes medications and, having like advanced diabetes, they shouldn't be just doing intermittent fasting on their own. And of course, if you were nursing or pregnant, you shouldn't be practicing intermittent fasting.
Okay, that's good to know. We're getting so many good questions. Everyone is very engaged, which is wonderful. Going back to we'll get to sleep in a second, but going back to the inflammation, as far as a diet, would you say that a plant-based diet is most effective diet against inflammation? Where do you stand on that?
Yeah, so I mean, like I would say, yes, it's the plants in the diet that contain all of these compounds that are antioxidants. So the majority of all your antioxidants are going to come from the plant kingdom, which reduces inflammation. So that the bulk of your diet should be plant-based. You can be completely plant-based and be vegan. Adding a little bit of fish, because fish has omega-3s in there. That's really nice and anti-inflammatory. It is a personal choice, I would say, as well. If you want to include some meat in your diet, then, really lean cuts of meat and, sustainable raised meats are
grass-fed, organic type of meat.
Because those types of fats that are in there and like commercially raised animals are inflammatory, basically. There are a different profile of fatty acid in there, so that creates inflammation.
Okay, so moving along to sleep, we talked a little bit about melatonin, and I'm just going to ask this as a quick one, but melatonin as a supplement, is that something that you would recommend as a supplement for better sleep?
Yeah, oftentimes it is included in the recommendation that I might make for sleep. I would certainly, recommend some other lifestyle changes or kind of do a review with a patient to make sure they have these healthy practices in place that could be impacting sleep. So we definitely always look at lifestyle as well, like looking at things like, are you having caffeine too late in the day, or drinking alcohol too close to bedtime? That can impact melatonin production as well. But yeah, melatonin is sometimes part of a recommendation I would make. But I already said I would caution about melatonin because there are some cases where I wouldn't recommend melatonin.
And also, you don't want to see it, like you're saying, it's not a quick fix, just pop the melatonin. But if you're still doing all of those other things, that wouldn't be the way to go.
Sure, you have the other things in check, but sometimes, sometimes people are doing all those right things, right? And it is just, product of aging. Melatonin levels are dropping. So a lot of times we'll use supplements with melatonin in there. We may use supplements that have herbs in there that have mild sedative effects to kind of like boost, get a sleep cycle back on track for a period of time and then maybe be able to pull it away. But sleep is so critical that we really do want patients to be sleeping, that sometimes we are just like, we've got to get you sleeping because there are all these other health problems going on. We at least have to get a sleep cycle reestablished for someone.
Dr. Stagg, so many women that I know are saying that they are chronically tired and that they complain of brain fog. Is it just because of poor sleep quality or these other things like caffeine, or is there something having to do with as we age that could affect our sleep?
Yeah, so absolutely. So, sleep can definitely be making a huge impact on our energy levels throughout the day. And chronic stress can also have a profound impact on sleep quality. So you could, be getting what you think is good sleep. But now, of course, we have devices that we can check to see how deep our sleep is and look at our sleep cycle in that way. But, if sleep doesn't seem to be an issue, and we certainly get this as a really, really common complaint. I see this routinely, women with, brain fog, chronic fatigue. First of all, we'll definitely look at medical causes, look at, thyroid function, make sure this person's not anemic or have vitamin deficiencies. But we do often find vitamin deficiencies. And as we age, we are more likely to have various nutritional deficiencies like vitamin B12, for example. So we can check some of those levels on blood work. But a lot of times it is, a lot of it can be diet related, and it can be, from this kind of inflammatory diet, chronic inflammation, sometimes food intolerance, eating too heavy a meal, glucose regulation. There's a lot of different reasons why people are tired, but it's a huge, huge problem. I see it all the time.
Yes, I feel like so many people I know, that's something that they talk about. You wake up in the morning and you're already feeling tired and you haven't even gotten out of bed for the day. And that's just something that none of us experienced in our younger years. It's just not fair. Okay, so moving on from sleep, that brings us to stress, because you touched on stress a lot throughout this discussion. We all know stress is bad for us, and especially now more than ever, we're really feeling it a lot. But how bad is stress for our health? Tell us more about its role in the aging process.
Yeah, so stress, what it does, that stress response that people experience will cause elevations in some of our hormones, especially cortisol. And cortisol is this hormone that many people have actually heard about. A lot of people come in asking me, can you check my cortisol? Like they actually know about it. And you can do lab tests to check cortisol levels. But what cortisol does is that it has the ability to increase inflammation. It causes you to maintain fat mass in your midsection, like you'll be more likely to deposit fat in your midsection.
That was that belly area you were telling us about.
And that leads into that cycle of being stuck kind of in that inflammation. And we know inflammation, aging, we went all through that. The other thing that cortisol does from chronic stress is that it does change gene expression. So it does go back to that whole like epigenetics that I talked about in the beginning when we were talking about how genes get expressed. Stress has that impact on how your genes get expressed. So, I'll have women all the time who are exercising, they're eating a clean diet, they're sleeping, but they're chronically stressed and they have health conditions. And it's like, oftentimes it's the elephant in the room, it's the stress. And so we have to work on managing that stress response to get them into a better state of health.
Okay. So in terms of techniques to manage the stress and be better about it, is there something that you would recommend there?
Yeah, so there's a lot of different ways to manage stress. And this is where we think about, like, as naturopathic doctors, we're always trying to personalize things to make it work for you. So for some women, exercise is their way of managing stress. Getting outside in nature is really, really important, I would say. That has been shown to lower your pulse rate. It reduces rates of anxiety. It reduces muscle tension, meditation, yoga, gardening. It could be art, creativity, gratitude. And then I would say making sure you're maintaining really good connections with people. So social connection is a huge problem in our country. And there are actually studies on this whole social connection piece of it. And if you have low, and I don't think this is necessarily true in this community here, but low social connection is meaning that you don't feel like you have good relationships and don't feel well connected with your community, and it doesn't have to be a large group of people, just feeling like you have like close connections that, are healthy connections. If you don't have that, that's the same as the health risks as being an alcoholic, smoking a pack of cigarettes a day. It's 2 times worse than being obese. And it's like the same as, or worse actually, than not exercising. So that's a really, really important part. And we all know how we feel when we get together with friends and how that stress seems to kind of fizzle away, right?
Okay, I'm looking at some of these really fantastic questions. Going back to, let's stay on this for a second in terms of, you were talking about social connections right now, and that just makes me think of what we're all doing at home right now in terms of the pandemic that we're in on Zoom and stuff. We're trying for the healthy diet, we're trying for the exercise. What else can we do right now during the pandemic? As far as somebody was asking, are there certain supplements we should be taking every day that can help maybe boost our immunity?
Yeah, so there are some really basic supplements that are very safe. that even like Dr. Fauci had went on record saying he was taking much later than in the beginning of the pandemic. But vitamin D is important. And us here in Connecticut, a lot of people are deficient in vitamin D. And so vitamin D has been shown to be associated with improved outcomes in COVID infections. Vitamin C is also a really important immune supplement. We also think about probiotics as well. And there are some really nice European studies that have shown, again, like improved outcomes with supplementation with probiotics for risk both of like, poor outcome from COVID infection, but we've known from a long history that helps with reducing even getting like various types of viruses, cold and flu viruses.
Can you talk a little bit more in terms of what is a probiotic? Is this something we should all be taking daily?
Yeah, so probiotics are actual bacteria, healthy bacteria that inhabit our intestinal tract, but all through our mucous membranes and on our skin. So when we think about taking probiotics, a lot of times we think about it for digestive health, which it certainly plays a role there. But it is really important that bacteria in our intestines do have a really big impact on our immune system. So probiotics are like kind of in that top tier of supplements that I do recommend, especially during, cold and flu season to help for immune status.
Okay. Somebody here did a little research. They were on your website and you had an article regarding red light therapy and you called it the fountain of youth. Can you talk a little bit about this?
Yes. So red light therapy, this is a full body red light therapy unit. It basically looks like a big tanning bed, but it's a really intensive red light. It only is red light wavelength. So it has no UVA or UVB. So it's not any sort of damaging, increasing the risk of cancer. What it does is it impacts inflammation. So it lowers inflammation, which, you've heard me talk about that all the last half hour.
We know we all need that now.
Yeah. And so it acts like as an antioxidant, lowers inflammation. It helps with things like collagen production, which, I'm sure a lot of women out here are taking collagen supplements for skin health, but it does work on that as well. And so that's the main mechanism of action. So that has, a lot of carry through in, through like various body systems.
Somebody asked, should we ask our MD or our naturopath doctor before you start? Well, that would be the same, but before we start probiotics, someone was on them for a while and it messed up their thyroid medication absorption. That might be a little bit specific, but.
Yeah, it is a little specific, but what I would say with probiotics and with any supplement, like people can have very complex health issues. And yes, like I think it is important to work with a healthcare provider who understands this stuff. But even like a lot of medical doctors, primary care doctors here do understand, vitamin D supplementation. They understand probiotics and often recommend probiotics. So I do think it's a good idea to just, run it by them if you have some health issues going on. With thyroid medication, I know that's a really specific question, but with thyroid medication, there are really, strict guidelines about like taking your thyroid medicine away from food, away from other supplements, that you can potentially affect absorption by taking it too close to your medication.
Okay. And the red light, going back to that for a sec, where is somewhere that somebody could get this done?
Yeah, so we have it in our practice in Avon. So we have the only unit here in Connecticut. The next one is in Westchester County, the same type of Theralite 360 unit.
Okay. All right. Well, I'm being given a signal that it's my last question. So I'm going to end in more of a general question. We would love to hear about the role of life view in aging. What does being an optimist do for our health? And and just in general, how we view the world, what does that do for our health?
Absolutely. So there's a large body of research on basically our life view. So that is, your guiding group of values, your sense of purpose, what drives you, what gets you out of bed in the morning and guides you through the day. When you have that sense of purpose that carries you through the day, whether it's, caring for a family, whether it's, caring for others, improving the lives of people in our community, exactly, what you saw in the video at the beginning that we all watched here, that does impact our health. And so it lowers the risk of dementia. It lowers the risk of stroke and heart attack. It lowers the risk of premature death as well. Being an optimist, having this sense that things will work out, is also associated with longevity and reduced risk of dementia, again, stroke risk. When they look at groups of people who live 90 till they're 95, 100 years old, they tend to be easygoing, they're more outgoing, and they, by and large, are optimists. So we know it is a really important characteristic and, a guiding principle.
I love that. It's sometimes tough right now, but I think we're seeing the silver lining. So we have to think in that manner. I am being told that we can ask a couple more because we're doing really well on timing. So I'm going to look at a couple of them from the viewers over here just to see what they had wanted. There was a bunch in terms of going back to okay, why don't we do this one? In terms of menopause, a number of women are wondering about tips for dealing with symptoms of menopause, especially hot flashes.
Mm-hmm. Yep. So I see a lot of that as well. So diet can make a big difference there. Having a lot, some of the first things we think about there are things like making sure you're having a lot of green leafy vegetables, cruciferous vegetables, lemon juice. We do think about things that have some ability to regulate hormone clearance, which is what those do. Depending on the situation, sometimes we are recommending things in terms, supplements that have some mild phytoestrogen-like activity to really settle down hot flashes. But that would depend on health history. So certainly if someone had a history of hormone sensitive cancer, if that's in the family, we're very careful about that. But, managing stress is important for hot flashes, that when you're under a lot more stress, it's going to cause the hot flashes to be much more elevated. Unfortunately, reducing alcohol is important for hot flashes.
What else?
And not that one. But there are some really great formulations that we tend to use. Hot flashes, with diet and lifestyle, maintaining exercise and healthy habits, that gets you a little bit of the way, but a lot of times you do have to use basically a supplement to help regulate the hot flashes.
But at least that there is help out there. You just have to explore it a little. Don't feel like you're on your own, because there are things, there's remedies to ease it.
For sure, absolutely.
Another one, you touched on collagen before. Collagen supplements, talk about this. We hear it all the time for our hair, for our nails. Does it work? Do you recommend it? I know personally I've heard, yes, you could use it, but the minute you go off, everything goes back to how it was. What are your thoughts here?
Yeah, so there are really good formulations of collagen in the marketplace, and then there's basically junky collagen in the marketplace. So you really, if you're not educated about it, you don't know where you're getting. So if you're just taking collagen and you don't know, about how to determine whether it's a good product, and honestly, it's really hard to say. If you just look at the label, it will just say hydrolyzed collagen peptides or something like that, and that is really meaningless. So in terms of, this is where naturopaths look at this. We look at sourcing. We look at proprietary ingredients. Where are these compounds coming from? Is there clinical data to support that? The collagen that we use in our practice has 3 different forms of proprietary collagen that comes from this company called Gelita. And they've done clinical studies where it supports, of course, skin and hair, but it also supports bone health and joint health. So they have research with, pictures looking at fine lines over time on collagen supplementation, that it definitely makes a difference. And then also there are studies looking at, joint health, like looking at MRIs over a period of time on collagen supplementation, and you can see some of that joint filling in because, you know, as we age, our joint space starts to change. So yes, like collagen can be helpful, but you really need to be getting good quality collagen.
Good quality. And is it true that the benefits go away the minute you stop, or you need to be on it forever?
So it won't necessarily reverse. You'll just go back down, like, you know, if you're feeling in,
go back to where you were.
Yeah, exactly. So then it will start to decline again. So yes, like once you start on collagen, like you do need to continue. That's something you would have to continue to take in order to maintain those benefits.
Okay. Going back to before when we were talking about like compliance and, you know, knowing what to do and having the tools, some women were saying, you know, and we all know this, we just have trouble with compliance. We know what to do, but we can't keep it up in a meaningful way. How do you help women change their habits for the long term?
Yeah. So, I mean, that's the $1 million question there, right? How do we do that?
I hope you have the answer.
It is. So, it is. I'll just say it's the biggest challenge that I encounter in clinical practice. And some of the things that have been helpful have been things like genetic testing, because once people have genetic testing done and they find out, for example, that they have the gene for high cholesterol or they have a gene for obesity, like we can test to see if you have a gene for obesity. There are studies that show that once you've had genetic testing, you will make better lifestyle choices. So, you know, that's one compliance piece, that when people do genetic testing, that can help with better health outcomes. Some of the other things are just like maintaining like check-ins, like being held accountable.
Being accountable to someone.
Yep. And it doesn't necessarily have to be like me, right? Or it doesn't have to be your doctor. It could be a buddy system. It could be a group of women that you're like checking in with, that you're finding a way to maintain accountability and stay on track with your healthy habits. But it is challenging because it takes about 4 weeks to maintain a new habit. However, once you get that habit established, you can be derailed by stress, right? So like this is what I see all the time. Something happened, all this stress happened. This patient was doing great. I hadn't seen her in a couple of years. She was good to go. And then something happens in their life.
Sure, life happens.
It does. And so, we're human and this is what happens. So, managing stress is actually really important, and finding ways that when that stress comes into play, that you're able to manage it and not just kind of go off the rails, right?
It sounds like these days so much more, it's so much of a bigger picture than just, what you're eating or what you're taking. It's managing your life, it's an all-encompassing picture that makes up your health. And that's what we're learning more and more from you.
Absolutely.
This is an interesting one. This is something, I guess, years ago, we talked a lot about the current research on soy products and breast health. What is your current verdict on this? Is soy safe? Is it not? Should we be eating the edamame at the sushi restaurant? No?
Yeah. So no, essentially what I would say is that, you want to be eating soy products in their more like natural form. So things like edamame, tofu, tempeh are better. Like those are good sources of soy.
Okay.
But I would also qualify on top of that, it really should be organic sourced soy, because that impacts hormonal health. So like soy products are actually supposed to be, the clinical studies, there have been studies where they've enrolled breast cancer patients in that they have enough data to make a statement that it's safe, that they can enroll breast cancer patients in studies where they're trying to look more specifically to see how much benefit there is. But what, we see like all throughout, like epidemiologically, all throughout like Asia, like Japan, high amounts of soy intake and really low rates of breast cancer.
Okay. So that's really good, actually, because I know a lot of us were really conservative in how we were looking at soy in the last few years.
Yeah. So I would just say be cautious about these products that have like isolated soy protein. Like, there's a lot of protein bars and things out there that just have manipulated textured soy protein. I would really avoid those and stick with more of the natural forms of soy.
Okay, that's good to know. Somebody was asking, we're drinking filtered water and missing out on the minerals. Can you talk about how to incorporate minerals into our diet?
Yep. So that is a good point. And so you can, if you're drinking filtered water, it is stripping many of the minerals from your water. So like you can also drink like some bottled mineral water is one thing that you can do. You can use electrolytes that you add to your filtered water, which would provide some of those. And then there are multivitamin blends that have some of these trace minerals in there. And that can be a big issue for many people, but there are ways around it. And yeah, I lost my train of thought on that. I was going to say there's a lot of trace minerals in nuts and seeds. So I always like recommend and encourage people to have like serving of nuts and seeds or 2 in their daily diet.
Well, that's good to know. So we can get back the minerals in that manner.
Yeah.
Nuts and seeds. Okay. Good. We have answered a lot of questions. Lori, are we good on time? Give me a thumbs up. I know I passed my limit. Okay. All right. Somebody was asking about, we got that one. Sorry. She's writing. So 1 second, excuse me.
Okay.
Go back to mine over here. I think we answered most of these. Is there anything else that we haven't touched on that you think would be like something of note that we should all really know about while I'm waiting for these?
Yeah, I guess what I would say is that, like, we talked a decent amount about stress, but I would say that is mostly what is affecting people. And certainly over the course of the pandemic, that has been a huge issue, a lot of mental health concerns and problems. I've been seeing that in clinical practice, and it really is so critical for our health to get a handle on managing stress better. I really can't emphasize that enough, that 70% of illness, basically these are the statistics that seem to be summarized, that 70% of a lot of the health conditions we encounter in Western society are the result of stress. So, whatever you can do to like simplify, reduce stress, living mindfully, living, in the moment. Something else, another technique I talk about in one of my books is the concept of time segmentation, of like, we're here right now, be fully present in what what this event is, and not be distracted, and put your full intention into that moment. And I would say this is, really wonderful kind of topic with this event, living with intention, of always thinking about like, okay, well, this is the segment that I'm in, live with the intention of fully being in that moment. And then when you move to the next segment, and maybe that's like carpooling, or not much carpooling now, but driving a child to an activity, driving to school, you're in that moment, stop thinking ahead. Because that is a lot of what like the stresses is that most women deal with, is just trying to keep it, you're continuing to think ahead. And a lot of times the thinking ahead is not getting you anywhere. You know that stuff anyway. You can deal with that in the next moment. And maybe that one of these moments is sitting down and like, making that list of what you have to do, and then taking the time out in segments. So think about like that segmentation, and being, living with intention in the segments throughout your day.
Being present. And I feel like, especially during this time where all of our lives have slowed down a bit, being home much more and not socializing in the same way, we've had that opportunity to kind of focus on, taking time for ourselves where we can, and being more present in the moment.
Yeah.
So, but stress management, that's probably the toughest one.
Yep, absolutely.
Someone was saying, what are 3 things that we can do daily or weekly to help with stress? They're looking for specifics. So you had said the exercise, the socializing, but I'll let you tell.
Right. Yeah. So I would say, we talked about a lot of those. So it could be, a gratitude journal, or even before bed. Like I kind of think about like, and I often recommend this to patients, to, when you close your eyes, you're ready to go to sleep, think about the 3 times during the day that you felt your best. When did you feel, the happiest? What were those 3 moments? And they may be, and a lot of times when you think about those, they're really simple. they're, you know, simple interactions or simple things. But like when you head into sleep in that time frame, in that state of mind, that does help with kind of getting like better quality sleep. So that helps with that stress component. I would say, and you know, like yoga, I think, is a great tool that we can all do now because of the pandemic. There are so many apps for yoga, and you can do like a 10-minute of yoga, like yoga session, right? So that, you know, being able to do that at home, I would say that would be a really good second one. And then getting outside in nature, like I think, and it doesn't have to be for long periods of time, but like, I think being disconnected from nature is a big problem that we face in our society.
Those are all really good. Someone was asking, what are the difference between your two books? Everyone here tonight is going to be receiving very soon your Unzip Your Genes book. What are the difference between the two?
Yep. So Unzip Your Genes is focused more on most of what we were talking about tonight: lifestyle, how it impacts our genetics. There's a lot of material in there about the microbiome. There's it does you know, describe a lot about how, you know, like impacts through our life can impact gene expression. So, you know, early childhood impacts, even, you know, our genes are impacted by even things that happen to our parents and a generation before that. So if you think about the impacts of that, so there are big studies on like the Dutch famine, the Holocaust, what like that stress that impacted the genes is passed on through successive generations. It's not just nature nurture, which is what they thought, but it's in our genes.
It's actually in our genes.
Yeah,
that stress or situation. Yep. Wow.
So there's a lot in there about that. And then my second book is more diet oriented. So it is like if you want to learn more about like the specifics on what health components of a healthy diet. There's a lot in there about digestive health. We didn't even get into that tonight, but there's a lot on digestive health. We did talk a good amount about like stress and some of these other hormones and even digestive hormones that's in there. Yeah, the second book is, you know, more of a different angle on diet and digestive health.
When you talk about diet and digestive health, we hear a lot about superfoods. Are there any superfoods that we can quickly, I know, you know, we're running close to time, but that you could touch on for us and just tell us which ones we really should be incorporating into our diet?
Yep. So I would say dark berries are a huge one. So blueberries, raspberries, you can get these frozen, incorporating those into your regular diet. Herbs and spices. So the more of those, the better. Those are antioxidant powerhouses. So, you know, this time of year, there's not a lot of fresh herbs. I mean, you can buy them at the grocery store. You can put them on your counter. Like you can get them potted that they're growing fresh. So I really—
What about the dry ones? Like
the dry ones are great too. So you can do
good.
So, but I do like a combination. And then obviously in the summer, like I grow an herb garden and I would like use tons of herbs. So you always want to be thinking about like in your meals, how can you get more herbs and spices in your meal?
That's great.
And then I would say, you know, things like garlic, onions, if you can tolerate those. Some people don't do well with onions or garlic, like some people have genetic issues with garlic, but incorporating a lot of those in your cooking as well. You know, beans are really good superfoods. Nuts and seeds are superfoods. Mushrooms. So mushrooms are actually a superfood. There's research showing that even like the simple button mushrooms can reduce breast cancer recurrence. And so, you know, that like that's its own sort of own kingdom. Like it has a different division. It's not technically a plant. It's fungus, right? But mushrooms are really, a powerhouse for superfoods.
That's good to know. I guess I have to start eating mushrooms because I don't love them, but I'll eat them if they're beneficial. Somebody was asking about, you had mentioned bars before. There's all of these bars out, the protein bars, the meal replacements. What are your thoughts on this? I mean, should we be taking these for meal replacements? Are they good for us? Or are they basically candy bars?
Well, some of them are for sure. Some of them I wouldn't recommend eating, but sometimes there, there's a need for it. Like when people were more busy and they were kind of like, on the go and they didn't have access to really healthy food, then I would say like certain bars are fine for like to kind of cover you so you're not eating something you really shouldn't be, right? But ideally I would say eating like whole foods, like not necessarily manipulated food, right? The closer you can get to the food in its whole form, the better off you are.
Okay. Somebody was asking the title of your second book, The Bitter Prescription. Why bitter?
Yeah. So there are three reasons. So one is because the dietary piece, I'm talking about like bitter components in food that don't necessarily, it's a chemical classification, these bitters, and they don't always taste bitter. Sometimes they do. But bitters basically are antioxidants, and they're really important. As we talked about antioxidants and inflammation. So that's one element of it because it's the classification with the diet. The second would be, I do talk about stress, but I talk a lot about bitter feelings. So that's the bitter, play on words. And then the third is the bitter truth of what we need to do as we need to do it. But it's a specific bitter truth. It's that as we age, and I didn't say it yet tonight, but as we age, we do need to eat less. So like our bodies just don't, that's why it's a bitter truth. We just don't need.
Ain't that the truth?
Yeah. So that's a hard one, but it's true.
That is. Lori, how are we doing on time? Done? Yes. Okay. I'm looking at my timing thing and I think that we're there. So I am just going to say, Dr. Stagg, thank you so much. This has been such an incredible discussion. I feel like we got to touch on so many fantastic topics and everything. So thank you for joining us tonight and taking your time. It was wonderful. Thank you.
Thank you so much for having me. It was a pleasure and I'm just honored to be here.
Oh, thank you. Really, the honor was ours. This was terrific. And I feel so thankful that I actually got to talk with you because this was wonderful. And now I would like to introduce Carolyn Gitlin, Chair of our Federation Board of Directors.
Good evening, everyone. Dr. Stagg, you were tremendous. I know you personally. This probably goes against HIPAA, but I am a patient of Dr. Stagg. And I want you to know that you just enlightened us so much tonight. And Jessica, you're like a pro. You're like Katie Couric over there interviewing her. And it looked like we were watching two friends just have a really intellectual conversation. So
it was such a great conversation. I really enjoyed it so much.
It showed. You did look like you had honest joy in your face. Before I move on, I just want to know I'm having connectivity issues. So if for some reason I freeze, Dana Keller is going to pretend she's me and give the rest of this little thank you, but hopefully I won't freeze. But Jen, Dr. Stagg, what you said tonight, you said gratitude releases stress, and you said being in the moment and being present also releases stress. And I know every woman that is watching right now has tremendous gratitude for what they learned from you tonight. So you just released a lot of stress and we were definitely in the moment. So I think we're gonna all go to bed tonight feeling a little less stressful and really grateful for the gift you gave us tonight. It really was special and I wanna thank you. You know, we started Living with Intention in 2014 and you're probably thinking, well, how does, learning about unzipping our genes and everything we heard tonight relate to being a Jewish woman? But in 2014, when we were thinking about this series, we were thinking about the Jewish body, the mind, and the soul. And programs like this bring the philosophy together that if we have healthy bodies and our minds are clear and focused and our Jewish heart is nurtured, we will be better women. We will live a more meaningful Jewish life. And that's how Living with Intention came to be. And tonight, not only did we learn about improving our health, but you learned about what a difference we're all making in supporting the Jewish Federation. And that is just so important. And we're also so grateful. So there's another way we're reducing stress, because coming together as a community is so important. And everybody on this call helps in so many different ways. Your time, your talent, your resources. And there's a quote that I love. And since yesterday was Dr. Martin Luther King Day, I thought I would share a quote from Dr. King. And he says, "Only when it is dark enough can you see stars." And you know what? We are living in a little dark era right now, but you are the stars, and it really shines. And our community is only stronger because of all of you. So if you would, during these trying times, I want you to remember that all of you together, we deliver meals to Holocaust survivors. We pack Dignity Grows packs for women in need. We make calls to inbound isolated seniors. The list is endless. And you also donate to our annual campaign, and it meets critical needs in our community. And I want to thank you all for that. And if you would like to learn more about our annual campaign and how you can support it, you can reach out to Judy Schlossberg, our Women's Philanthropy Chair, or you can reach out to Lori Mandel, our Women's Philanthropy Professional. And we want you to know we are so grateful for your support. So grateful that our stress is reduced tonight. At this point, I do have to thank our business partners, and Sam's going to put on the screen for all of us to see. It's very important that we have business partners in this community because it offsets the cost of programs like this tonight, and so that more of your annual campaign dollars can go back into our community. So take a look, and now Sam, you can bring it back so I can look at everybody and see their smiles. And of course, Judy, thank you so much for being an incredible leader for women's philanthropy and bringing this to light tonight. And Nancy and Jessica, you had a vision for tonight and you really brought it to fruition, and you both did such an incredible job. What a gift you gave all the women on this call tonight, truly. And of course, to the Federation staff, you don't see it, but behind the scenes, there's a flurry of, activity, and they are unbelievable. So we hope you all enjoyed tonight. Dr. Stagg, thank you so much. And you are in luck because on Thursday night, Dr. Stagg is speaking at the Mandel JCC to talk about her other book, The Bitter Prescription, Engineering Your Diet. And it's streaming at 7 p.m. on the Mandel JCC Facebook page. So we can get more of you, Dr. Stagg. And thank you so much. I think that we are all leaving tonight just a little bit better off and knowing how we can just take our bodies by the steering wheel and live a more healthy and meaningful life. So thank you so much. And everybody, you can unmute.